We are currently receiving many questions from people who are diagnosed and being treated for pulmonary fibrosis about what does this pandemic mean to them. There are many things to consider if you have pulmonary fibrosis. The first thing is that pulmonary fibrosis is a heterogeneous term, and there's many different subtypes of pulmonary fibrosis. That means there's many different ways of trying to treat this disease as well. If you're on medications that suppress your immune system, such as prednisone, that medication will increase your likelihood of developing any infection in general, including COVID-19. So how do you reduce your risk? The simple answer is to follow what the Public Health Agency of Canada is recommending, which is 1, stay at home as much as possible, and in fact, work from home if you can. 2, if you do have to go out, practice social or physical distancing by staying at least 6 feet or 2 meters away from anyone. 3, washing your hands with soap and water for at least 20 seconds or using lots of hand sanitizer. And doing practical things like asking trusted ones to go out and get your groceries or your medicines so you can stay at home as much as possible. The second thing to keep in mind is to try to keep in contact as much with the physician that's looking after your pulmonary fibrosis. This is a rapidly evolving environment with COVID-19, and it's good for you to keep in touch with someone that is looking after your care for pulmonary fibrosis. The one thing to keep in mind with any chronic respiratory illness is that if you're to acquire COVID-19, the symptoms that you may experience may be more severe than someone who does not have an underlying lung condition like pulmonary fibrosis. So you'd be more subjected to developing more shortness of breath, more chest pain, or maybe requiring a hospitalization. So anything we can do to try to prevent this infection from acquiring it would be important. The good news is that from early reports in the evidence that's coming in the literature, patients who have pulmonary fibrosis are not being overrepresented in the population of patients that are being hospitalized. So that's a good thing, but to minimize your risk, it's staying at home is the most important thing that you can do. While at home, it's also very important for you to continue to stay active. Exercise and physical activity are important foundations of treatment for any chronic respiratory illness. So I'd ask you to speak to your provider of care for your pulmonary fibrosis about what you can do at home to stay active. And if you do go outside for walks, to again practice physical distancing by staying those distances away from everyone else. Again, this is a very rapidly evolving environment, and we ask for you to come back to this page as often as you can for updates as the information becomes available. Thank you.